Ja, hallo, herzlich willkommen zu dieser Ausgabe unseres Podcasts und YouTube-Videos Zähne und Gesundheit. Heute eine spezielle Folge, nämlich eine Interviewfolge mit einem biologischen Zahnarzt, nämlich Dr. Stuart Nunnally aus Texas in USA. Diese Folge wird auf Englisch sein und Sie wissen ja, man wächst mit der Herausforderung, also ruhig auch in Englisch einmal diese Folge ansehen. Und ich freue mich sehr, dass er hier ist bei mir und hat auch kleine Wurzeln, auch in Deutschland. Wir haben gerade kurz darüber gesprochen, aber wir haben uns entschlossen, das Interview auf Englisch zu führen. So, welcome to this episode, and it's a kind of interview episode, and I want to welcome Dr. Stuart Nunnally from Texas, USA, who is a colleague and also a biological dentist, and I'm really thankful that you have the time and we can meet here on Zoom over, I don't know how many thousand kilometers. It's just great that we two can use the chance to talk here. So thank you for your time and welcome on this podcast, on this YouTube show.
Thank you, Alexander. I'm delighted to have the opportunity.
Yes, perfect. Thank you. So would you mind just giving us some information about you, who you are, what is your work, what is your profession, so that we can get to know you a little bit more?
Sure. Well, this is actually my 40th year in dentistry. I'm 66 years old, and I've never been more excited about dentistry than I am now. I have a holistic biological dental practice in Texas and 3 partners. We see patients from all over the world, and it's a joy to get to do what we do. And so we have a very holistic approach to how we take care of our patients. For example, we're very careful about what dental materials we utilize. We want to make sure that the materials that we use are compatible with each patient's immune system. We typically do a blood test to determine their compatibility, and there are at least 2 labs in the world that will evaluate your blood serum to see what materials are compatible. So we utilize that test frequently. And of course, the things that set us apart, I guess, more than anything, are the fact that we're very careful about what materials we use. We don't typically recommend root canal treatments. We really believe that there are better therapies than that. And then, of course, we also are very, very interested in treat jawbone osteonecrosis. That's a big part of what we do, and along with that, with using nutritional techniques and high doses of vitamin C and platelet therapy, all of those therapies, those are the sorts of things that would set us apart from the traditional dentist.
So your description actually could be exactly the description of our practice, of our clinic here in near Munich. We are located in the south of Germany and also have 4 dentists working exactly the same holistic approach like you. And we come to this later. And so, the most biological dentist, and you said you are getting really excited. You have never been more excited than now in these times. I think it's because of the new chances, the new possibilities we have with holistic dentistry, with biological dentistry, as we call it here. For me, for example, there was one key moment when my eyes were a little bit open for the holistic way. I think you had maybe also a similar moment. In my case, it was when a young patient who was suffering from epilepsy came to our clinic, and his doctor told us, please remove the amalgam fillings, and we removed them under protection circumstances. 4 to 6 weeks he was completely healthy again. So he lost this epilepsy. And this was for me one moment when I said, wow, what did I do right now? I just was doing my handcraft, like a dentist, but improved somebody's life really. Did you have also a moment like this, which just was making like wow, or do you treat people like this already for the whole 40 years, or did you have a traditional approach from the beginning,
Yes.
and it was a shift or something?
I had quite a shift. Interesting that you should mention this issue with epilepsy and removing mercury fillings. We've seen that numerous times as well.
Yeah.
Over the course of the last 20 years. Really, it's the last 20 years for me where we've had this emphasis on biological dentistry, mainly because I got sick myself.
Oh, wow.
Yes, I had practiced for 20 years, very traditionally, and basically my practice was a cosmetic dental practice.
Okay.
And about 20 years ago, I began to have neuromuscular issues. I had a lot of weakness, particularly on my left side, many cramps that you couldn't necessarily work through. And all of a sudden, I found myself being referred to the largest Lou Gehrig or ALS center here in the United States in Houston, Texas. We thought that I had the neurological disease of ALS.
Wow, which is quite a big issue if you have ALS, if you would have had.
Yes, yes. And actually, it was a long recovery for me. It was about a 3.5-year recovery. But as it turned out, the primary issue for me was mercury toxicity. And so even though I had not put a mercury filling in almost 20 years, I had been removing them and not protecting myself.
Yes.
So I sat there in this little mercury vapor fog each day,
definitely.
And finally it was enough to overwhelm me.
Yeah, so just interesting because I read a study which shows that the suicidal rate under the group of dentists is very high, and I think this is one reason that many dentists work under the poisonous mercury toxins. And have no protection, and so as we both know, the mercury destroys just the neurons in the brain. I think this is one big thing which many more dentists should know about for themselves.
I do too, and we know it's interesting how we don't get training in that at all, and we know that dentists have a very bad neurological track record. Suicide being one, of course. We lead all professions in suicide. Depression, we lead the professions in depression, and also in divorce and all sorts of emotional and psychological issues that I think we can attribute at least somewhat to our mercury exposure.
So for you, it was 1.5 years of therapies or of recovering again, and then it was, what did it make with you and your mind, with your view on dentistry?
Well, it's actually 3.5 years. I was a competitive triathlete, and so it was about 3.5 years before I could jog again.
Wow.
And but at any rate, I'm back 100%.
Great.
And
you look great. You're in good shape. And you told me you were on your bicycle just before this talk. Great. That's great.
Yes. Well, I'm so grateful to be back and have my health. And so, yes. So I actually went to Montreal, Canada for treatment at that time, thinking that I had ALS. And as it turned out, of course, I had this mercury exposure. But at that time, I was exposed to a dentist there who is sort of the grandfather of holistic dentistry in the United States. His name was Hal Huggins.
Yes, of course. Yeah, we know him.
Well, so Dr. Huggins, um, he treated me, and as a result of that, I had quite a paradigm shift, and I went from being more of a traditional dentist to
Yes.
a holistic dentist very quickly because I began to see improvements in my health
Yes.
after he did the therapies that he did for me. And I was exposed for the first time to high doses of IV vitamin C. I had never been around that. It was the first time I ever heard that root canals might be a systemic health issue.
Yes. Yes.
And of course, I had hardly ever heard the term that we call in the United States cavitation, a cavitation being jawbone osteonecrosis. I was not really familiar with the term, and here it was. I had these lesions,
Yes. Yes. Me
which
too.
yes, and I had these cleaned out when I was in Montreal, and it had very significant health
Yes.
consequence for me. I did much better afterwards.
Yeah.
So that's what happened.
Well, great, great. So what I always see is if a dentist is on the pathway of biological dentistry, he stays there, and it's just something which opens his mind, and you go this way, and you come deeper and deeper and deeper, and you practice it in your office, and you see the results, you see the recovery, like you did in person with yourself. You see the recovery with patients, and I think, please correct me if I'm wrong, but I think this is the thing what you meant when you said it's never been more exciting to with your profession, with dentistry. Is it the
No,
feeling
absolutely.
of changing really the system, of helping really people just with your hands work?
Yes, it's absolutely the most exciting thing to really participate in
Yeah.
someone's overall health.
Yeah.
And as you know, we partner with wonderful integrative holistic physicians from around the world who
Yeah.
they do what they do best, and we do what we do best, and the
Yeah.
patient works at it, and all of a sudden we get a good result.
Yeah. So we both agree very much, I think, about the importance of biological or holistic dentistry. What about the public, or how well is the biodentistry? How well is it known in the United States? Is it accepted fully? Is it very famous? Is it very popular, or is it just a small group of conspirative dentists who practice this?
It is still relatively small, but it's certainly growing
Yeah.
because the public is demanding
Yes.
our services.
Yeah.
And the public is tired of the traditional, what we call allopathic way of being treated,
Yeah.
and which primarily just puts a patch on a system instead of getting to the root cause of issues.
Yeah.
And that's what I love about being a part of holistic dentistry and medicine, is that we're always looking for the root cause of the illness.
Yeah, yeah, definitely. So it's the same here in Germany or in Europe. We are also a small group, but it's really true that the group is expanding, and the knowledge, we try to expand the knowledge. For example, in Switzerland, I was trained and worked together with Dr. Volz in the Swiss Biohealth Clinic, and I give also some lectures and courses at Swiss Biohealth, and we are in the Swiss Biohealth Academy. And one of the aim is to, we too know that there are thousands of studies who prove it, how bad are root canals, how bad toxins from cavitations are, and so on. But it's not written in the books, and we don't know actually why. And many critics from this holistic dentistry say that there is no study, but there are thousands of studies. Yeah. And our aim is to make new studies also with the universities, because if you get it in the head of the professors of the university, then someday you get it in the books, and when it's in the books, then it goes into university and to the students, and then this is the way of thinking. We have maybe a new generation of dentists. So this is so that not only the public supports us, but also the university supports us. This would be, I think, what do you think about this? Would be a really game changer.
I think it's, I love that. I love that approach because, and even here in this country, we have an organization. It's worldwide now, and I know you're familiar with it. The International Academy of Oral Medicine and Toxicology.
Yes.
Is now what we're doing as an organization is we're reaching out to students, to dental students, because we're finding that more and more dental students are interested in the holistic approach. So we're encouraging those students to come to our toxicology meetings. And now we're finding that more and more of them are ready to enter into holistic dentistry at the very beginning of their careers.
Wow.
So, and of course, they're introducing their other students and their professors to these concepts.
Yes, I understand. I understand what you. It's great. It's great to go directly to the students. Yeah, we have to take influence where we can. Yeah, definitely. Absolutely. Because it's so important what we do. And so let's talk a little bit about what kind of patients come to your clinic. Is it just describe a little bit what kind of patients visit you?
The majority of our patients have some sort of autoimmune disease or maybe some chronic degenerative disease. We do see many patients with cancer. And of course, the major autoimmune diseases that we all know, like multiple sclerosis, and of course, all of the autoimmune diseases that we typically think of, like rheumatoid and lupus. Those are very common for us, and we have found that dentistry can have a profound impact on those diseases.
Yeah.
So it's we love to see those patients. It's a joy for us to see them because we feel like we can really be a help to them.
Yes. So do you have also, we have the same group of patients, so the people who are chronically ill, but what we have also is, I call them, the people who are healthy, but want to do everything that keeps them healthy. They heard about root canals, they heard about cavitation. So for example, me, I try to be and keep in a good shape as far as I can contribute to it. And I myself had 4 cavitations, and I was not suffering from any illness and had them removed. But when they have been, the surgery has been done, I felt very much different. My mind was much more clearer, my energy was better, my sleep was better, my decisions were better. And I thought I was okay. I thought I was healthy, but it's really a shift, and I still think you have also the same patients who are not healthy but want to keep healthy and then improve. That's true?
Yes, and more and more, Alexander, we see patients who maybe do not have physical symptoms as much as they may have psychological or emotional or mental symptoms. And we know now, we have great studies that demonstrate the toxins from the bacteria that we're dealing with when we either remove root canal treated teeth or when we clean out cavitations. Those are very potent toxins, and many times they have a strong impact on the brain.
Yeah.
So I think our ability to help repair emotional, psychological issues is maybe as great as the physical symptoms.
Yes, definitely. In these times where the stress is almost overwhelming, and we have to be in a good physical and mental and emotional fitness. Yeah, definitely.
Yeah, exactly.
So let's hit the nail on the head. What are for you the 3 most or the 5 most important things you think that people should know about? We mentioned some already, but let's summarize it. So what are the three most toxic things? Because maybe some listeners or watchers do not know what you're actually talking about. So what is
Certainly
dangerous in the mouth?
Well, let's take the three most toxic.
Yeah.
One would be heavy metals, and the worst one would be mercury.
Yeah.
And just as you have in Europe, we in America have used mercury amalgam fillings for years.
Do you still use them? Not you personally, but is it used in the USA?
It is used. About 50% of the dentists still use mercury fillings in this country.
Same here.
Yes. We think it's I personally think it's one of the most absurd things in all of medicine and dentistry. How could we continue to do that when we know mercury's a toxin?
Yeah.
Not just a toxin, but probably the second most toxic material on the planet.
Yes.
So mercury is one of those things that we want to remove safely, and it certainly has no place in the body whatsoever.
Yeah.
And then
just one thing, you said one word, one very important word: remove it safely. This is just for our listeners. It's very important. So if you know that amalgam fillings with mercury are toxic for you, there's a good way to go to a dentist and ask him, please remove it. But the first question is, how will you remove it? How would you do it? Because if you have the fillings removed, you have to ask and go sure that the dentist uses high security measurements, that you have really the best conditions and no mercury comes into your body. But maybe you can explain it better in your language, because it's your mother language.
Well, no, I think you're right. In fact, if you can't have them removed in a very safe way by someone who's very experienced in that, in those techniques, then you're better off just leaving it in, because you're going to get such a mercury exposure if it's not done properly.
Yeah.
And so the first line of defense in removing mercury fillings is you want to make sure the dentist is using what's called a rubber dam to isolate the tooth, to isolate the mercury, so that we don't ingest any of that when it's removed. So all the particles, because when we touch that mercury filling with a drill, we're going to scatter that material everywhere.
Yeah.
And so the other thing you're going to want to make sure is, I would make sure that the dentist himself is wearing a respirator. If he's wearing a respirator and his staff is wearing a respirator, then you have to think, well, he's probably doing some very protective things here. So those are two, I think, very important things. So we look like spacemen when we work. If we're removing mercury,
like warriors.
Yes. And our patients are completely covered.
Yeah.
There's their skin is not exposed, their hair is not exposed.
Yeah.
And of course, we have extra suction to remove any of the particulate. In our case, and in our office, and maybe in yours as well, we like for the patient to be on an IV vitamin C drip at the same time, just because the vitamin C is so protective. It elevates our levels of glutathione, and it helps. So it's a wonderful protective thing. And then, of course, let me just share with you this, and I'm sure you're familiar with this, Alexander, but this organization, the International Academy of Oral Medicine and Toxicology, has established a safe protocol.
Yeah. Yes.
And the protocol is called SMART. It's called SAFE. The acronym is for Safe Mercury Amalgam Removal Technique. So anyone in your audience could Google IAOMT, IAOMT.org, and then the SMART protocol, and they would see a video on everything that we think is important in order to remove mercury safely.
Yeah, so we are, because you mentioned we are the one and only at the moment smart certified clinic in Germany. So this is a kind of, I'm a
Oh,
little bit proud
beautiful.
of that. Yeah.
Oh, that's so good.
Okay, so we talked about mercury. So this is number one, I think. Okay, what is the second and number three toxic things in the mouth we find in
Yeah.
our patients?
Number two for us is root canals.
Yeah,
And of course, for 20 years, I performed root canals. I felt like that was a, a good procedure, and we don't want to lose teeth.
yeah,
So,
yes,
so
exactly.
I did root canals, and I just simply was not aware of research that suggested root canals had a high degree of toxicity associated with them. But once I became aware of the literature, I could not do another root canal.
Yeah,
And so in fact, it's been a chief area of study for me for the last 20 years. I read everything I can about root canals, about some people feel like they can produce a safe root canal. Most of
yeah,
us, including me, feel like
yeah,
it's not possible.
yeah,
So over the years, I've seen some dramatic changes in people's health when we
yeah,
remove their root canals.
yes.
And so that in our practice, if a patient comes in and they're insistent upon a root canal, we're going to find them someone who can do a beautiful root canal.
Exactly,
It's
exactly. If you once are familiar and you know what happens with patients and how stupid it is to, if you know it and how dangerous is root canal, you never can do it again. It's just
right.
about it's just, we can't just do it. Yeah, we act the same like you. It's great. Yeah, but
That's it.
also for the listeners, it's a really for us, it's a decision from the heart and also from the head, but
Yes.
It's partly very difficult to communicate to the patients because they come here and say, okay, please do me the root canal, but we
Right.
cannot do it. Just believe us. We only want our best. We want to protect. We want your best. We want to protect your health. So this is, for us, it's impossible.
Well, it is for us as well.
Yeah.
And we know that the literature very conclusively demonstrates that you cannot get a root canal sterile. It will always be infected.
Yes.
And we don't. We know, even we would know, even as a layperson, that it makes no sense to leave something dead in the body. And so that's what a root canal is. It's a
Yeah.
piece of dead tissue, and it remains infected.
Yes.
And now we know that the toxins from those bacteria are very potent,
Yeah.
and can cause a wide range of systemic health issues.
Yeah. And you have that toxic influence. If you have a root canal, you have it 24/7. Yeah, you
Correct.
can go to a holiday or to lose your weight or your stress or take in vitamins. You can do all that. That's all great. But if you have 24/7 toxicity here in your jawbone, which is very important because it's very close to your brain,
Yes,
with the nervous trigeminus goes directly to the brain, or
exactly.
it's very much blood goes into the jawbone and it just spreads all over the body, and this is very, very important. And many people think it's not hurting, so why should I remove it? But the
Yes,
difference is just once the acute, we call it acute, is it the right word? So the chronic infection, you don't feel it, and the
yes,
painful infection, this is what
yes.
you feel. And many people say, okay, I don't feel it, so it's not dangerous, but that's not true. The chronic things are often more dangerous than the painful things, where you have
Yes.
straight pain.
And there are many, many disease states that are not painful.
Yeah.
Many cancers are not
Yes, look at
painful.
cancer, for example. Yeah.
Yeah, diabetes is typically not painful.
Yeah.
So the presence or absence of pain is not a good indicator
No.
of disease.
Yes.
And
so the
go
third
ahead,
thing, I
please.
think it's the most unknown here, and maybe also in the USA, is the cavitation.
Yes.
So let's talk about that. How would you describe it so that everybody who is not dentist can imagine what we're talking about?
Sure. Well, a cavitation is as it relates to our jaws, is a stagnant area in the jaw where there's very little blood flow. Sometimes there's no blood flow to that area. And it's filled with bacteria. It's a very fatty area. You have, of course, a wonderful dentist in Germany named Johann Lechner, of course,
Yes,
who
of course.
has published a good deal on this, and he even calls it fatty degenerative jawbone osteonecrosis or something like that.
Yes.
So
Exactly.
I'm a big fan of his and his research. I think it's been very, very helpful. But we know that when a jawbone becomes anaerobic, when there's not oxygen or blood flow, we know that you build up these degenerative fatty cysts in this jawbone. And of course, when we remove that, it looks like fat globules, and it's very infected.
Yes.
And it has a very characteristic look to it. And we know now that there are a number of systemic health issues associated with this disease in the jawbone. We also know, of course, this is the most common site for these, but also these same types of osteonecrotic areas occur in the hip, and they occur in other bones in our body as well, usually from trauma. And so I think it's very, very important that they be recognized, number one, by someone like you, Alexander, because in the United States, there are probably not more than 100 of us who really recognize this and who treat the disease.
Wow.
I think there's probably not that many. Okay. And so it's just not well recognized. It's in our country, the most common textbook on oral pathology talks about treating this disease, but it somehow is skipped over in dental training. And it's completely skipped over. So dentists just are not trained in it, and oftentimes don't even believe the disease exists.
Yeah. So, but it would be very easy to diagnose it. Yeah. It's not something very miraculous or something. You have just we use the 3D scan, and you can see it very clearly because the low density of the bone there, and if the bone density is low, it's just like a hole in the bone. And as you said, exactly, the hole is filled with fat, with necrotic tissue, full of bacterial, virus, toxins, with run test, which is a very it's a marker for the chronic inflammation, in short words. And we also I read some studies who found glyphosate there.
Yes.
Yeah.
Yes.
It's something which nobody should have actually, and it's easy to diagnose, and it's really treatable. You know, we have a tool for that. We know what to do with that.
Of course. And what we, of course, like to do, I think we've been using for the last 8 or 9 years now, when we clean these out, we draw blood from the patients, and we spin that blood in a centrifuge and remove their platelets and stem cells. And of course, we then put those back into the surgical site, and the healing is just amazing.
Yeah. So just one specific question between two biological dentists, you know, okay, so you treat it the same like us, you make a surgery, clean it. We, for example, we use piezo surgery technique and clean it with ozone, fill it with PRF, the stem cells you told, and make a really good suture. Many patients especially from the US, come or ask us on via email or Facebook or so, and they describe a technique to inject ozone there. Is it very famous in USA? What is your opinion about that? Does it work in your opinion? Is it an alternative really? So we do it here in Germany, and to be honest, if I clean a cavitation, I do not think that an injection of ozone could really cure the bone and make healthy bone again. So this is my opinion. But what do you think about that?
I agree totally. To inject ozone into an area that has very, very little blood flow, you may eliminate the bacteria temporarily, but anytime there's an area in the body that has minimal blood flow, it's an area that tends to repopulate with bacteria.
Yes. What else should it do? Yeah.
Of course, so we have to surgically clean that out, establish a robust blood flow into the area, and then these will heal. And of course, the addition of platelets through this PRF technique is a tremendous tool for us, because when we concentrate the platelets bring in a whole host of other healing mechanisms to make this area heal. I think it's one of the best adjunctive services that we can use, and over the last 20 years of doing these, I think it's been the biggest change for us in terms of getting these to heal properly.
Yes, definitely. So it's exactly like you say. What we do is we clean it. We use ozone after the cleaning to sterilize and to make disinfection. Then the stem cells. To put it in a nutshell, what we want is we want to clean it, and we want new blood cells in there. We need the blood in there. So that's all about, because where there is blood, there is the chance to rebuild healthy bones. So that's all what we want. We do not want to leave a cavitation after us. We want to give the body the chance to rebuild new healthy bone. So we are actually very much into biological dentistry now, but this is our passion. So it was clear that we come to this point.
Yes.
Can you describe, besides that, some components of your biological treatment protocol? So we heard about ozone, we heard about cleaning cavitations, about PRF, so the stem cells we put in there. What else do you use in your protocol?
Yes, well, I'm a big fan of high dose vitamin C, IV. So we do that typically the day of treatment and then the following day. And then we encourage the patients after they get home, wherever they go back home, to follow up and continue to do that for the next 6 months.
Yes.
So we're a big fan of high dose vitamin C.
So how many grams do you use there for one IV, for example?
Typically 25 to 50 grams.
Okay, great, yes. Great. That's really great. Yeah.
Yes. And then we also, of course, we like the use of acupuncture and acupressure. So on our staff, we have acupressurists. We have several where they do acupressure before the treatment and immediately after, and even the following day, to help open up these meridians so that we get good energetic healing.
That's great. Great.
We love the use of acupressure.
Yes.
And then I think there are a number of other things that we.
For example, about vitamins, because you talked about vitamin C, which is a really powerful tool. What do you think about vitamin D and its importance about building new bone? Do you have a look at that?
It's tremendously important. I think it's tremendously important.
Yes.
I think vitamin D and K2 are, that's a wonderful combination.
Yes. We do exactly the same thing. Isn't that amazing? Yeah.
Yes, truly.
So that's really, really, really great. Really great.
Yes.
So just for the watchers and listeners, vitamin D is very important for many things, but for example, for the immune system in general, for building up the neurotransmitters in the brain. But why are now two dentists talking about vitamin D? Because we talk about surgeries, and many studies found out that if you have a lack, or if you have too little of vitamin D, you cannot build healthy bone. So this is what we want. If we treat cavitations, what we need is healthy bone. If we put in implants, we need the bone grow on the implant. And therefore we have a close look at vitamin D. For example, in our office, we really take care and are very exact about that our patients have a vitamin D level of 70 nanogram per milliliter, because the Professor Schukrun is a very famous professor. He had many studies about that, show that then you have a high chance that the body can build new strong bone.
Exactly.
You have the same
Yes.
the same procedure. You also support and give the supplements for vitamin D, or take care that the
Yes.
patients are up there.
Yes, we encourage them, of course, to be doing that. And most of the physicians who refer to us are overseeing that part of their treatment to make sure that their vitamin D levels are sufficient.
Yeah. So you told me that many chronic disease or patients with chronic disease come to your office. Do you have also patients who say, okay, please, doctor, you're my only chance, and please give me back my health? And you know what I mean?
Almost every day.
High expectations. How do you deal with that in the communication with the patients, with yourself, and how do you deal with that? We can make a really, really big difference. How do you deal with the expectations? We have it every day, like you said. Yeah.
Well, that's a terrific question, Alexander. It really is, because as you know, that puts quite a burden on us to think that a patient would come in and say, "You're my last chance." And I don't really want to shoulder that whole responsibility, because I want to offer everything I can. And in my own case, I'm a Christian dentist, and so I'm giving. I tell the patients I can do everything I can to help you to heal, but I tell the patients, God is responsible for your healing, and your relationship with Him is going to help get you through this more than just me doing the surgery. I think I can do the surgery beautifully for you, and we're going to remove these metals.
Yes.
But there's more to healing than that. For example, and you know this from experience, if a patient comes to you and they have very little hope, and spiritually they're a wreck, their chances of recovering and thriving are not as great as if they're emotionally and spiritually healthy.
Yes.
So I think that's a huge component to someone's healing. And I know I actually experienced this in my own life. When I got sick years ago and we thought I had ALS, I thought I had ALS. I was convinced of it, which is almost as bad as having the disease.
Yes.
And it looked like my future was so bleak, and I know what it is to lose hope, and that's a very dark, sad place to be.
Yes.
And your potential for healing is not good when you get to that place.
Yes,
definitely. So for me, as a Christian who I have now a hope in the Lord and a relationship, that helps me, has transformed my life. And I want patients to also understand that transformative healing that comes from having hope. And for me, it's God and it's Jesus. Maybe for others, it's another. But It's bigger than yourself.
Yes, yes. So, for example, one picture that I use is I said to the patients, okay, look, you have been on the way in your life for 60 years, and it's like if you're wearing a bag on your back. You know what I mean?
Yes.
So
Yes.
through the life is, we call it rucksack. Is it rucksack?
Oh yes. Oh yeah.
Okay.
Ik verstehe.
Good. So you have this bag on your back, and through the whole life, there are many stones come in it. Yeah, many stones,
Yes.
small stones, big stones. And if you have been on this way, your body gets weaker and the weight is getting heavier. What I cannot promise healing. You know, we see it very often. We see healing, we see improvements. Sometimes in several cases we see nothing. Okay.
Right.
So, but what I can promise you, and this is what I say, I can promise you, when we fix the dental situation and take out the toxins, take out the mercury, we take some stones out of this bag, and the bag is not as heavy as before, and maybe your immune system or your body has then a better chance for recovery and for to get healthy. And what I can promise you, we can take out the stones. You do not have to carry root canals. You don't have to carry mercury, and then you're on better chance to get healthy. And so this is the reason why it very often happens like this. And
yes,
I also say what Dr. Klinghardt says, he's a German doctor, but he has also famous clinic in Seattle in the US. And he says about 70% of all chronic diseases come from the jawbone, come from the teeth. So this is a big chance. And it's the stone, what we're taking out from the back here is not a small stone. If you talk about 70%, it's a big stone. And I would say, I always suggest use the chance to clean this area. Let's take out a big stone and let's see what happens. In many cases, you know, we have improvements almost every time. We have healing sometimes, but if we do not see anything, we did not do anything bad, you know. But we remove the stone. So maybe the key to healing is somewhere else. We are not God. Yeah. But we can do our
and
best.
you know, I think that's a beautiful analogy, and we know that these are magnificent bodies. It's amazing what these bodies tolerate and what the toxicities that we're exposed to, and yet we manage to live, and most of us live very, you know, we live better than you would expect with all of the toxicities that we're exposed to. It's amazing.
Yeah,
we have magnificent bodies, and so often, you're exactly right. When we remove a big stone, when we remove one source of infection, it's amazing how the body rallies and can begin to spiral back to health.
That's great. That's great. We can help it, and the body itself can deal with so many things. Yeah, it's the power of the body, of the self-healing is gorgeous.
It is, truly.
So, okay, we are two dentists. We always talk about teeth and dentists, but not only because we're dentists, but also it plays a really big role. But let's put the teeth and the jawbone on one side. What other things do you recommend for your patients? What do you think is also one more key to success, to the key to health besides the teeth?
Sure. For me, for my patients, it's clean water.
Okay.
Clean air, sunshine.
Yeah.
Sunshine, physical activity.
Yes.
To sit, especially in front of a computer all day long, is a recipe for disaster. We have to be moving, and we have to get fresh air, sunshine, and clean water.
Yes.
So that's very important for me. And then, of course, if we're not eating organic food and nourishing this incredible body that we've been given, that too there's probably nothing more important than that.
Yeah. Do you have an advice for the listeners to clean the water? Do you suggest a certain device, or how do you clean the water?
Great question. It's a great question. So in this country, I think obviously there are all sorts of different filters, but I use a particular filter that not only removes chlorine, but also removes fluorine, because it's a common practice in the United States to add fluoride to the water system.
Wow.
Yes, which we think is a terrible mistake.
Yes, we had that many years ago in Switzerland. I don't know which country they tried to put it in order to reduce the decay of the teeth, but it did not work. But
yes, no, it does not work. But it's a terrible contaminant. Yes. And of course it interferes with our thyroid function, and really it interferes with every cell in our body. So we like clean filters, or another way to get rid of at least the chlorine in the water is using a reverse osmosis type of water filter. So how about you? What is it that you like to use for clean water?
Well, we also have we use the water here is pretty clean, but it's not perfect, of course. We use filters and some kind of energetic information, which prove that it causes the Emoto crystals, you know.
Yes.
And it's just energetic information, and it's really awesome to see. And some people taste it, and you drink more water, and also the animals, if you put them this water and normal water, they go to the higher energetic water. That's kind of same but a little bit different approach than you.
Yes, I like that though.
So in my opinion, I agree totally with you. In my opinion, there is also to take care of the sleep, to have a good sleep place, get enough sleep. First of all, enough sleep. Good sleep, it means long terms of deep sleep and REM phases, and especially, and you mentioned it before, and I listened very closely. Also, the emotional situation, the relationships. You have to take care about our relationships and to be together with people who we love and who we like, and keep distance to negative people, or so, this is just take care about our relationships, because the human being is a social thing.
Absolutely. And as you know, Alexander, when someone comes to you with a chronic disease and you do their dentistry for them, they're much more likely to heal if they have family support. And if, one of the things that is the most difficult thing to overcome is to have, for example, a woman come to us whose husband is not in support of what she's doing. Or if they have a negative relationship, the ability for her to heal is, it's decreased manyfold.
I'm also a great fan of Tony Robbins, and he says, for example, that the thing of choosing your relationship, your partner, has a very big influence, not only on the quality of life, but also on the length of your life. It's always a question of relationships, and there are toxic relations and there are healthy relations.
That's right.
So let's take care about that. That's great.
I think that's very important.
The human being are social beings. We could, the interview is recorded in May 2020 during the so-called Corona crisis, COVID-19 crisis. So here in Germany, we had a shutdown with isolation of people and keeping them at home, which is actually against nature. we don't have to discuss here if it's necessary or not. You know, we don't want to get political here. But what do you think when we have to deal with a virus, no matter if it's called influenza or corona or next year another name? Yeah, we never had before.
Sure.
So what do you think? What are our chances in these times?
That's a great question. And to me, and I don't mind saying this, I think the response to the coronavirus has been mishandled worldwide.
Yes,
it's been fueled by media hype. It's not been based on reality. The idea, for example, of wearing a mask to a public place is bizarre. It has there's no medical precedent for doing that, and it does more harm than good to restrict your own oxygen and to breathe CO2 in instead of. So all of that to me has been a mistake. And viruses run their course. The way to handle this is, if you're a chronically ill person, isolate if you wish. Don't isolate from everyone. You must have social relationships in order to thrive. And those relationships also help stimulate your immune system. To isolate and then reemerge, hoping that that your immune system is going to continue to function properly, is incorrect. It will not. You're going to be much more prone to disease if you don't continue to stimulate your immune system. So this whole idea of isolation when we're in one of these pandemics, to me is absolutely absurd. You're right, we're social people. For me to isolate during this time would have been a terrible mistake. I would have been depressed. And some of our dearest friends have chosen to isolate. I'm telling you what, they're not the same today.
Yes.
They're struggling. They're struggling. They have a negative outlook on life. What we have to do is protect this amazing body that we've been given, and we'll be resilient. Even if we get the disease, we'll be able to handle it.
Definitely.
This is not a typically a life-threatening disease for anyone who takes care of himself.
Yes.
This notion of isolation to me is a terrible mistake.
Yes, definitely. And I can suggest or just to listen to the Tony Robbins podcast, because he has recently done an interview with 6 experts from the USA, really from Stanford University. The podcast lasts about 2 hours, and it's really amazing facts about that. And it's so, in 2 or 3 years, when we look back to this time, I think we will see which big mistakes we didn't make. And you said it, to make isolation is only sensible for a very, very small group of chronically ill patients who have a certain age. So that's it. It's no reason to shut down the whole economy for the whole world, or for USA. And we see here already the numbers of suicides are rising very high, and they will continue rising, because what happens, the economy shuts down. You have many people lose their work and have more and more troubles, more and more aggressions, depressions, and all that will will lead to higher suicide rates. This is just one effect, and only the idea, there is a virus outside, let's go inside and hide until we go out and the virus has disappeared. It could be, I don't know. It's unrealistic. Never was.
Well, it's there's nothing whatsoever about that is based on science. There's nothing about that's based on science. We have I heard recently this. This has not been a. This has been a pandemic of words. This is.
Yes.
This has been the media and the politicians uh, driving a disease that could have already been handled, in my opinion, if we had just let it run its course.
Yeah.
This has been a media that's driven this to the point of hysteria.
Yeah. Completely right. And again, as we talked before, it's up to us to think about our relationships, and we have to take care about our relationship towards media. Yeah, who do we listen?
Well, true.
To? What do we believe? What do we let into our ears and into our brain? So this is the one thing, and we have the chance. When a virus comes in, I have a beautiful body, as you say, and I have an immune system. So I'm responsible also for myself. So, and then we are back again to our both work. We have certain tools to boost our immune system. Yeah, get rid of the cavitations, rid of the root canals, rid of the mercury. Get vitamins, get healthy food, get good water, get good relationships, get good sleep. So that's a lot to do. Yeah, let's do that. Yeah,
let's do that. Let's do that.
Okay. So, wow, was amazing, Stuart. I'm very thankful and very grateful. And we mailed, I don't know, 1-2 weeks before, and we met here, and it only took 1 second, and our frequencies were like this.
Yes,
It's really
I
great.
agree, Alexander.
Just a big honor and a big pleasure to have this amazing talk with you. Thank you very much, and I wish you all the very best. You're an amazing person, amazing doctor, and I think with your level of energy and your spirit and your mindset, you will be able, together with your colleagues and over the world, to make this place really a healthier and a better place. Like we have the possibility as dentists to contribute. Yeah, that's all.
We do, and thank you. What a privilege to spend this time with you today. Yeah, I can't wait to come see you.
Yes, definitely. So have a good time. All the best. Bye bye.